Hello, my name is Joey Luna, and I'm the CEO of ABC Medical Center. Today I'm going to talk to you, my staff, about the new EHR system that we have put in place. For those of you new to our team, and those of you on our existing team, there are some new and interesting features that we have with this new EHR system, and I'm here to talk to you about them. For those of you not familiar with what an EHR system is, an EHR system is an electronic health record. Think of it as an electronic record that can save your patient's data and files for their entire lifetime. And these records that are saved are from various sources. So they can be records from their inpatient procedures, outpatient procedures, hospital visits, medications, and more. Okay, so these are very complete records. The EHR system that we have now is a big improvement to what we had before. So EHRs, as I just told you, they're a complete medical record for the lifetime of their patient. The EHR system that we have will help physicians and other providers streamline their workflow and also help them prevent errors. And I'm going to talk a little bit more in depth about that. But today I just kind of wanted to give a little background into what an EHR system is, what peripherals we can use with the EHR system, and some new technologies that we might be implementing with this, okay? So, our EHR system has something called a CPOE, and a CPOE is a computerized provider order entry. And this is implemented into our system, and this allows providers to enter orders such as radiology requisitions, discharge instructions, medications, and other things using their computers that they will have at their desk. So it's a convenient system for the providers to use. What I wanted to talk about also is we have something built into our EHR system, and this is called the decision support. So with decision support, if a physician were to enter an order for a certain type of medication that had contraindications with another type of medication that this patient is on, this decision support would alert the physician and help them avoid making a medical error. So that's a really awesome feature that our EHR system has. Our system also has some peripherals, and I'm going to talk about that now. So peripherals are things that can be used and accessed by patients. So it's a convenience for patients. And we have on our website, if you go on our website and check out where we're talking about our EHR system, you're going to see a logo and it says blue button. So what blue button means is that it's a symbol that shows that our hospital systems allow patients to have downloadable access to their health records. So that's huge, right? That's like a big deal for patients. They want to be able to have that access at their convenience, right? Another peripheral, well, one of the peripherals that we have put in place is called, well, it doesn't have a name yet, but it's a secure texting tool. So with this secure texting tool, patients can communicate with their providers at their convenience, okay? So that is another convenient way, and then it's considered a peripheral for physicians and patients to communicate with each other. A lot of us have cell phones. The majority of the world has cell phones. A lot of people don't like to get calls, or they're too busy to be answering calls. So with this tool, this makes communication with their provider a lot easier, right? Something we also have is called Health Vault. And with Health Vault, users can upload documents and images. And And there's also compatibility with self-monitoring devices. And let me talk more about that. So Health Vault can link up with certain types of monitoring devices such as glucometers or glucometers, blood pressure monitors, and other things. And it's pretty cool because it can capture data and report that data to providers. I think that's a really neat tool that'll help get patients proper diagnosis if the provider is able to have this kind of access. So that is Health Vault. I already talked about mobile phone apps. So that, again, mobile phone apps are going to be integrated into our EHR system, and that is going to help with communication with patients and providers, right? Another thing that we are going to implement is the use of social media. So there's a lot of social media outlets out there right now, and we're going to look into seeing which ones we can reach out to our patients and potential patients with. So with that social media, we want to be able to communicate, we want to have a big emphasis on the communication of preventative care. So preventative care is something that we really want to educate our patients with. If people can prevent a disease, it's better than having to treat a disease, right? We will discuss more about that at a later time when we get that system up and running. So I already talked to you guys about our EHR, the peripherals, what we plan to do, and the convenience of it. I understand that there could be a learning curve using this EHR system. In the next few weeks, we're going to be rolling out education for the EHR system. So be sure that you are ready and prepared to be educated on this system, and please ask any questions to help you learn to use the system. Again, with the proper usage of the system, it'll provide ease of access for patients, for providers, and it can help physicians, providers, and other hospital staff make any medical errors due to that decision support system, right? Okay, if anyone has any questions, just feel free to email me, okay? And I will be rolling out that schedule for training within the next few weeks, okay? All right, see you all soon.